Hello, everyone, and welcome back to Navigating the Periphery. My name is Deborah, and this... Any guess?
Philip?
Yes, very good. This is my son, Philip.
Hello!
How is everyone doing today? If you're into what we're doing on this channel, you guys know what to do. We want to try and get our message out there and try to reach and help as many people as we can. Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis, one show at a time. If you know anyone who could benefit from watching this channel, please help. Spread the word.
Remember, it's okay not to feel or be okay all the time. You are not alone.
We're here.
We are here.
So, Philip, you're happy today?
Yes.
All right. So, I'm glad you're happy. I'm happy too, and excited to discuss today's topic. But first, I would like to give a disclaimer here. We are not medical doctors or professionals.
No, we are not. Emphasis on not. Our channel is for information and education purposes only. And I am speaking to you guys out there from my personal life experience with OCD, GAD, and schizoaffective bipolar type.
Yes, please refer to our disclaimer at the end of this video and every video that we put out. So, Philip, take it away.
Today, we are going to navigate the periphery of obsessive-compulsive disorder and its potential link to schizophrenia and or schizoaffective disorder. As I have shared in previous episodes, I presented at 8 years old with severe OCD. And then, at age 22, I was diagnosed with schizoaffective disorder bipolar type.
Which is now changed to schizoaffective
Mixed type.
mixed type. So, obsessive-compulsive disorder, or OCD, in childhood and its potential link to schizoaffective disorder is an area of ongoing research and interest in the field of psychiatry. Schizophrenia is a mental health condition featuring symptoms of psychosis, a mental state in which the brain's perception of reality becomes skewed or inaccurate. Hallucinations, delusions, and disorganized thoughts are the hallmark symptoms of psychosis seen in schizophrenia, and schizoaffective disorder comes with some of those same symptoms, but is also accompanied by a mood component, that being bipolar or depressive type. Now, obsessive-compulsive disorder, or OCD, involves intrusive thoughts, urges, and mental images called obsessions that are neutralized by repetitive, ritualistic behaviors known as compulsions. Both schizophrenia and OCD can involve unusual behaviors, anxiety, and impaired daily function, but there are major differences that set them apart.
Schizophrenia and OCD are associated through something called
comorbidity. Philip hates that word. Comorbidity is just a technical term for conditions that occur at the same time.
schizophrenia and or schizoaffective and OCD are commonly seen together. Older research from the mid-2000s suggests as many as 30% of people living with schizophrenia report obsessive-compulsive symptoms, and 12 to 14% meet the diagnostic criteria for OCD. OCD can begin in childhood or adolescence, with the median age of onset usually around 19 years. However, for me, it was 8 years old. Some studies also suggest shared genetic factors between OCD and schizoaffective disorder, showing a potential common underlying vulnerability.
Some individuals with childhood OCD may later develop psychotic symptoms or mood disorders, which are components of schizoaffective disorder. While not common, there are cases where childhood OCD transitions into schizoaffective disorder or other psychotic disorders later in life.
And there I appear.
Yes, this applies to you. It's always about you, isn't it?
Well, it's technically my YouTube channel.
Okay, alright. Back to the topic at hand. So basically, some extended studies track children with OCD into adulthood to observe the development of other psychiatric conditions. Detailed case studies of these individuals provide insight into how symptoms evolve over time in individuals with childhood OCD.
I'm going to break the definition of this down so it's easier for you guys out there to understand.
Thank God.
In a longitudinal study, researchers repeatedly examined the same individuals to detect any changes that might occur over a period of time. In longitudinal studies, which are kind of correlational research, investigators watch and record many variables without attempting to manipulate them. Finding the strength of the association between the variables is the aim of correlational research. It's often used to test hypotheses, strengthen theories, or reject previously studied hypotheses.
While there is a detectable fraction of people with childhood OCD who go on to develop schizoaffective disorder, research does show that prevalence rates fluctuate. Identifying risk factors such as family history, severity of OCD, and presence of other psychiatric symptoms can help predict the likelihood of developing schizoaffective disorder.
And in my family's genetic history, there's documented OCD on both sides. I had a great uncle with paranoid schizophrenia, and my paternal grandfather had clinical depression with bipolar disorder. So again, hello. Welcome to my diagnosis.
And I have OCD.
The link between childhood OCD and schizoaffective disorder is complex and influenced by a combination of genetic, neurobiological, and environmental factors. Early identification and comprehensive treatment are crucial in managing symptoms and improving quality of life for affected individuals.
Ongoing research is essential to further understand the mechanisms and potential connection between the two conditions and to formulate effective therapies. So let's examine OCD and the OCD schizophrenia overlap. Schizophrenia and OCD seem pretty similar on the surface. Both can involve feelings of anxiety, emotional distress, functional impairment, and behaviors seen by others to be unusual or bizarre. The Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, indicates that both schizophrenia and OCD can feature anosognosia, which is a lack of insight into the disorder in which you don't recognize what you're experiencing or when you're experiencing a mental health condition.
The DSM-5 also notes that preoccupations with OCD may become so extreme and irrational that they can resemble delusions. Delusions, a primary symptom of schizophrenia, are false beliefs about reality that you keep despite clear, rational evidence against them. As I pointed out in our second episode, What is Schizoaffective Disorder? Here's what the DSM-5 looks like.
Sorry, I put it down too quick.
And if you want to purchase one, you can. Anywhere books are sold. We will also leave a link to that episode in the description box below. Now, there are very distinct differences between OCD and schizophrenia or schizoaffective disorder. Despite some overlapping symptoms, OCD and schizophrenia have important distinguishing features. While both involve anxiety, the underlying fears are different.
The worries involved in OCD and schizophrenia are also different. Someone with schizophrenia can have paranoia, a type of delusion, which is the fear that someone is plotting against them, whereas someone with OCD has a fear of something bad happening. Fears in OCD are often very specific, like a fear of contamination, whereas delusions in schizophrenia can be broader, involving many different behaviors and beliefs within the delusion.
The DSM-5 notes fears in OCD are also set apart from schizophrenia by the presence of prominent repetitive behaviors, also known as compulsions, which are directly used to neutralize a specific fear, like hand washing for germs, or constantly check locks on doors for safety. And hello, that's me. I do both of these things still to this day. However, I think the most significant difference between schizophrenia and or schizoaffective and OCD is how they affect your reality perception, at least for me. And please remember, I'm speaking to you guys out there on my lived experience with both disorders. I am not a doctor or medical professional.
Seriously, you're not?
No.
So, back to seriousness. So, more specifically, someone with schizophrenia or schizoaffective believes that their thoughts, delusions, and hallucinations are real, while someone living with OCD is in touch with reality and to an extent logically recognizes that their intrusive thoughts are not actual, real situations. Someone living with OCD can recognize that their thoughts are just thoughts. They're often distressed by them because they go against that person's inner values.
Like the, oh my god, I need to sterilize everything and wash my hands because germs are everywhere. Germs are not good, which is kind of irrational.
Yes, whereas someone with schizophrenia will believe that their thoughts are true, real, and actual experiences, and do not always see their thoughts as distressing, irrational, or unwelcome. OCD doesn't lead to schizophrenia or schizoaffective disorder, although these conditions may share genetic pathways that increase your risk of both disorders. So, is there really a correlation?
The bottom line is schizophrenia and or schizoaffective disorder and OCD are separate conditions that can occur together. Although they share general symptoms of anxiety, unusual behavior, and functional impairment. These conditions are very different at the core when OCD and schizophrenia occur together. They're still treated as separate conditions. Your psychotherapy and medications will be tailored to your symptoms and where you're experiencing impairment in daily life. Schizophrenia and or schizoaffective disorder are psychotic disorders featuring disrupted reality perception. OCD doesn't involve false reality. Even though obsessions may become extreme or irrational. If you're living with schizophrenia and or schizoaffective disorder or OCD, psychotherapy and medications can help you manage symptoms and improve your overall well-being.
So it's important to be diagnosed by a behavioral neurologist or a psychiatrist in conjunction with seeing a therapist. While medication can alleviate symptoms, therapy delves deeper, addressing underlying emotional, psychological, and behavioral aspects of any mental issue you are experiencing.
Well said.
Thank you.
Yes, medication and therapy both are extremely important for getting well and overall improvement. Again, I can only speak from my personal life experience with both of these disorders. I hope today's episode helped with the correlation of OCD possibly developing into a more serious psychiatric disorder like schizoaffective disorder. Thank you guys for tuning in today, and please remember that our signature catchphrase,
Yes.
it's okay not to feel or be okay all the time. You guys and gals are not alone.
We're here. Thank you so much for joining us today. And please remember one thing. Some people have just obsessive-compulsive disorder, and other people simply have schizophrenia and or schizoaffective disorder. We were just trying to link the genetic component on how both are related and how they can co-occur at the same time like they do with Philip. So we hope we got that message across today. So until we see you in our next episode, coming really, really soon, take care, have a great weekend, and bye for now.
Bye!